Welcome to the education piece of your joint replacement. We will be presenting information regarding your hospital stay and recovery process. This video will be a general overview. Specific questions should be directed to your surgeon. All information covered in this presentation is also in the book available online. All of you have your surgery date, but you do not have your surgery time. It is your doctor's decision what time your surgery will be. You should get a phone call on the day before letting you know what time your surgery is, what time you need to be here at the hospital. If you have not received your phone call by 3 p.m. on the day before surgery, you will need to call the surgery department to find out your time. That number is 515-263-5747 and is to the outpatient surgery department at Iowa Lutheran Hospital. If your surgery is on Monday, then you will receive your phone call on Friday. As far as your diet before surgery, we suggest you eat a light supper, which consists of soup, sandwich, salad, something easy to digest, and then nothing to eat or drink after midnight. As far as your medications before surgery, you're going to take all your regular scheduled medications up until the day before surgery. There is one group of medicines that you will stop before your surgery, and that's your blood thinnings. This also includes anti-inflammatories, such things as Advil, Aleve, Arthrotec, Voltaren, Diclofenac. We also include in those types of medications herbal products. Things like glucosamine, garlic, green tea, MSM. All of your home medications, prescription home medications, you will take the morning of surgery. Heart, blood pressure, breathing, stomach, unless you're directed differently by your surgeon. It is very important that we prevent infection in total joint replacement. You can help us reduce your risk of infection. Before your surgery, you should receive some special soap and some ointment that you will put in your nose for 5 days before surgery. Generally speaking, you will use the special soap in the shower every night for 5 nights before your surgery. The ointment, you're just going to put on a Q-tip, put a little bit inside each side of your nose twice a day for 5 days before surgery, including the morning of surgery. The morning of surgery, we prefer that you do not take a shower, just put on your clean clothes and come to the hospital. What else can you do to prevent infection? You need to remove all nail polish on fingers or toes. Please do not shave your surgical site for at least a week before surgery. No lotion, perfume, deodorant, makeup on the morning of surgery. It's very important that you also brush your teeth the night before surgery and the morning of surgery. The most bacteria is located on your body, in your mouth. We suggest you brush your teeth at least twice a day while you're here in the hospital and at least twice a day after you go home for at least 2 weeks. You must remove all your jewelry before coming to the hospital. If you have rings that are tight, I suggest you try and take those off before you come in. If you cannot get your rings off, please go to a jeweler and have them professionally removed. If you come in the morning of surgery and we cannot get your rings off, we will use a apparatus to cut them off, and it'd be much easier to have them done with a jeweler. Nutrition is very important to prevent infection. We suggest that for a couple weeks before your surgery, pay attention to your diet, do such things as lean meat, chicken, fish, fresh vegetables, fruit, high-protein foods such as cottage cheese, eggs, nuts, Greek yogurt. Pain control is very important after total joint replacement. You will find this is not a pain-free surgery. We're going to do the most that we can to help keep your pain level under control. Your anesthesia will play a big part in your pain control after surgery. So now we'll watch a short video from one of our anesthesiologists.
Hi, my name is Nick Aristoffel, anesthesiologist, here to discuss anesthesia and pain relief through your upcoming joint replacement surgery. Now, the exact anesthesia that you have will depend on your health needs and is going to be discussed between you and your anesthesiologist on the day of surgery. What we typically like to do for joint replacement therapy is a two-tiered approach to anesthesia. First, we like to offer you a spinal anesthetic. This is a one-time dose of medicine in your low back so that you go off to sleep from mid-abdomen down to your toes. This allows your surgeon to have the best possible conditions to work in, and we can put a small but very potent dose of morphine in this spinal anesthetic and get you the best possible pain relief for the first 24 hours after surgery. Once this spinal anesthetic is in place, we choose either heavy IV sedation or general anesthesia to get you through the actual operation, and then let you come back to your senses in our recovery room. In addition to that morphine in your spinal anesthetic, your surgeon will also place numbing and pain-relieving medicines in the tissues surrounding the joint that is replaced. Thank you very much for your time, and best of luck with your upcoming operation.
During the video, your anesthesiologist talked about general anesthesia. They talked about spinal anesthesia. Spinal anesthesia can play a big part in your pain control after surgery. It will start your pain control before you have pain. Many people are worried about having the spinal. It's actually a very easy procedure to have. You will meet your anesthesiologist the morning of surgery. He will explain everything to you. They'll have you sit on the edge of your operating table and bend over slightly. As you bend over, they will give you some relaxation medicine. This medicine also has an amnesic effect, so you should not remember getting the spinal or laying down. Again, you will meet with anesthesia the morning of surgery to determine which option is best for you. If you do have the spinal anesthesia, you may have a Foley catheter. Somewhere after surgery, until the next morning, the spinal will start to wear off. You will start to become uncomfortable. At that time, your nurse will ask you to rate your pain. We'd like for you to give your pain a number. 0 is no pain. 10 is the worst kind of pain you can imagine. Our goal is to keep your pain under control. You will have pain medication ordered as needed. This means you will have to ask your nurse for your pain meds. Most of your pain control will be done with pain pills. Your nurse will write on the whiteboard in your room when you received your pain medicine and when it is next available. This just means that is the time you can have your pain medicine. It does not mean your nurse will be in there at that time to give you the medicine. Please remember when asking for your pain medicine that your nurse does have other patients, so please ask early. There's a reason we don't just bring your pain medicine in every 4 hours and give it to you, whether you need it or not. Pain medications have side effects. One of the most common side effects of pain medication is constipation. We have pain medicine we'll give you to help with constipation, but again, it is a side effect we would like to prevent. Nausea happens after pain medication. We do have some other medicine we can give you to help with the nausea if you let your nurse know. The side effect we don't like from narcotics and pain medicine is sleepiness. There are times you can get so much medication that you are so sleepy you won't wake up. That is why we won't bring it in and just give it to you scheduled times. Pain control is more than just medicine. On this slide, you will see that there what we call a comfort menu. There are many suggestions for you to help with your pain control. If you use any of these at home now, feel free to bring them in. Such things as a radio, your own pillow, a warm blanket, aromatherapy. You are welcome to bring those with you when you come to the hospital. There are several things we're going to do while you're in the hospital to help with your pain control. Ice is going to be your best friend. You will use ice while you're here in the hospital. Please have ice bags ready to go when you get home. Ask for your pain medicine before you get up with physical therapy. Changing positions. It's amazing how getting up and going for your walk will make you feel better. Deep breathing and relaxation will help your pain medicine to work. Elevation helps a lot after surgery, especially when you go home. The most common complaint we get after discharge is swelling in your leg. It's very important that you elevate your leg 4 times a day for 30 minutes after you go home. You won't see much swelling while you're here in the hospital. It usually starts 3 to 4 days after surgery. So one of your main assignments when you go home is you need to lay flat 4 times a day and get your toes above your nose. Your leg's the flooded basement, your heart's the sump pump. Sump pump needs to be below water level to drain the basement. You cannot do this in a recliner. We're now going to talk about discharge planning. Your stay in the hospital is very short. It's usually 1 to 2 days after surgery. Most of our surgeons prefer that you do go home with some help for 3 to 10 days. If this is not possible, please discuss this with your surgeon before you have surgery. In order for you to go home, your doctor is looking at several things. One is to walk about 100 feet, able to get yourself in and out of bed, and have your pain well controlled. This is very difficult to do at home all by yourself. Please take time now and decide who will help you when you go home. It is also important that you know how are you going to get home. You can drive yourself to the hospital, but you're not driving yourself home. So please arrange with family members to have a ride 1 to 2 days after surgery. Because your stay is very short, only 1 to 2 days, we recommend that you have a coach for 3 to 4 days with you once you get home. This person does not need to be lifting you in and out of bed, carrying you to the bathroom. They are with you to be your brain. They need to be here and be present with you in the hospital on the day of discharge, so they're involved in your teaching. There's things you need to do at home now before your surgery. Get some meals made ahead of time. Who's going to help with the housework and the laundry? You are not going up and down the basement stairs to do a load of laundry. Do you need a rail on your stairs? Do you need grab bars in your shower? Insurance does not pay for any extra equipment, but please look at your house and decide what do you need and have that ready before you have surgery. We recommend that you sit in a firm chair with arms, something with firm bottom, arms to help you get up and down. Please do not sit in a soft sofa. It's too soft. You're not able to get yourself in and out of that sofa if you're by yourself. It's important that you bring personal equipment with you when you come in. Shaving equipment, your glasses, you need your dentures. If you use a CPAP machine at home, you need to bring that with you. After surgery, you're going to be more comfortable if you can wear some loose-fitting clothes, such as pajamas, sweatpants, shorts, and a t-shirt. Please bring in a good pair of walking shoes, something with good support. They can be tie, they can be tennis, they can be slip-on, but we do need good support. These are the wrong type of shoes. They have a heel. There's no back support. Sandals don't protect your toes. Please do not be walking barefoot after your joint replacement. You don't want to stub your toe, run the risk of getting an infection. Elastic shoelaces can turn your tie shoes into slip-on. These can be found at many different shoe stores, Walmart. Our hospital gift shop carries these. They're usually under $5. You put them in your shoes and turn your tie shoes into slip-on. Just a reminder for everyone that there is no smoking by patients, visitors, or staff at Iowa Lutheran Hospital. This includes e-cigarettes, vaping, chewing tobacco. The morning of surgery, you will check in at Iowa Lutheran Hospital. The day before surgery, when you get your phone call with your arrival time, they will instruct you to come to the front door. You will take the elevator down to A level to the outpatient surgery registration. You will be registered and taken to the outpatient surgery. You will check into surgery waiting. You and your family can wait here until they're ready to take you back into the pre-op surgery area. Once they're ready for you, the patient will go back into the pre-surgery area. They'll get you changed into a gown. They'll take your vitals. They'll also start an IV. While you're in the pre-op area, you will meet with your surgeon and your anesthesiologist. Your surgeon will come in. He will ask you, what is your name and what surgery you're having. It's not that he's forgotten. We just want to be certain that we have the correct patient for the correct procedure. Before you go into the surgery operating room, they will have you sign 2 consents. One is an informed surgical surgical consent. This lets everyone know that you understand the surgery you're going to be having. You'll also sign an informed consent for anesthesia. This gives your anesthesiologist permission to administer the drugs that put you to sleep. Please be sure and ask any questions that you have prior to signing these forms. This is a picture of the table you'll be on during your surgery. You will lay down, get some medicine to make you sleepy. Surgery itself will last about an hour. It'll take about an hour to get you ready. So you'll be in this room anywhere from 1 to 2 hours. Surgery's over and you're going to the post-anesthesia care unit. This is where you're going to wake up from your surgery. You will have a nurse there with you. She'll be at your bedside. She'll be monitoring your blood pressure and taking care of you until you're ready to come to your room. This is your room on the second floor of the north wing. We have rooms for 30 patients. They are all private rooms. Family member or visitor. The surgeon will talk with you after surgery, and when your patient is through in the recovery room, you will follow them up to the second floor. This is where you'll wait until we get your patients settled in their room. A recovery room nurse will bring you up to your room. All of our joint replacements will have AVI boots on their feet to help with circulation. These are boots that wrap around your feet, and about every 20 seconds, they're going to squeeze your feet, squirt the blood that's in your foot up your leg. Will help prevent blood clots. You will also have a pad under the calf of your leg. The purpose of this pad is to keep your heels off the bed. It's very important after surgery that you prevent pneumonia. You will get this little machine. It's called an incentive spirometer. It encourages you and shows you how to take a nice, slow, deep breath in. We would like you to do this 10 times every hour while you're awake in the hospital. Please take this home with you. Every time you take a pain pill at home, please do this 10 times. The most common cause of a fever at home is from your lungs. It's not from your hip, it's from your knees, it's from your lungs. It's very important after total joint surgery that you be on a blood thinner. We don't like people to get blood clots. Your physician will determine the most appropriate blood thinning medication for you. Many times it can be something as simple as an 81 milligram aspirin twice a day. When you do come up to the floor, you will receive this beautiful yellow name band. It says you are a fall risk. We would like you to please call us and not fall. Please do not get up by yourself. You may think you can stand on your own, but your leg is weak, your muscles are sore. Please do not get up by yourself. So it's the day after surgery, your catheters come out and you have to go to the bathroom. What are you going to do? We're going to give you a call light. We have a very nice call light here at Methodist West. As you notice on here, we have the big red button that just says, I need something. Also on this call light are some specialty buttons. One that says toilet, one that says pain. When you push the pain button, that sends a message directly to your nurse and tells her that you need something for pain. The best way to get your pain control is to let your nurse know when you need it. Activity is very important after joint replacement. Helps prevent blood clots, makes your therapy go faster. So everyone will get up the night of surgery. Your surgeon expects that you sit up in the chair and walk a short distance in the hall. It does not matter what time you go back from surgery. Your surgeon wants everyone up and walking the night of surgery. These are some examples of our hip and knee dressings. The dressing on the top is a gauze dressing. This just goes over your incision to give some protection. The dressing on the bottom completely covers your incision. It's waterproof. It will stay on for 10 to 14 days. Your surgeon will determine which dressing works best for you. Once your surgical dressing has changed, or we know that the waterproof dressing is dry, you can shower, usually the day after surgery. Please do not soak bathtub, hot tub, swimming pool, lake, creek for 4 to 6 weeks after your surgery. Now it's the morning after surgery. It's time for physical therapy.
Welcome to Inpatient Therapy Services at Unity Point Health Des Moines. Therapy in the hospital setting is the first step in your recovery from total joint replacement. Today, you will be introduced to the services provided by the physical therapist and occupational therapist in the hospital. Physical therapy addresses activities like getting in and out of bed or a chair, walking, going up and down stairs, and exercises. Occupational therapy addresses activities like getting in and out of a tub and self-care such as bathing and dressing. Your therapy experience at Unity Point Health Des Moines will be tailored to your individual needs as well as doctors' recommendations. So let's get started. When getting into bed, scoot back on the bed and turn your bottom towards the pillows. Lift each leg up onto the bed and move until positioned in the center of the bed. You may need assistance lifting your surgical leg into bed or positioning it in bed. Then you may lay back down onto the bed. When getting out of the bed, you want to bring your legs towards the side of the bed, push up onto your hands, and then move each leg one at a time towards the side of the bed. Continue towards the edge of the bed until both feet are firmly on the ground. When standing up from the chair, slide your surgery leg out in front of you, slide your bottom up to the edge of the chair, place your hands on the chair, and push up from the chair with your hands. Transition your hands from the chair to the walker as you stand up. When sitting down, back up till you feel the chair behind you, slide your surgery leg out in front of you, reach your hands back for the chair, and gently lower yourself down. It's recommended to have a shower chair and grab bars when possible in and around your tub. To get into the tub, back up to the bench as you would a chair, reach back and slide your surgery leg out as you sit down. Pivot on your bottom as you bring your legs into the tub. You may need someone to assist with lifting your surgical leg in and out of the tub. When getting out of the tub, reverse the steps above, lifting your legs out as you pivot on your bottom, slide to the edge of the seat, and stand using your assistive device as you push up from the bench. As needed, you will be introduced to different pieces of adaptive equipment, such as a reacher or sock aid. These are used for lower body dressing and assisting with activities of daily living. Your physical therapist and physician will work together to determine which assisted device, walker, or crutches will best suit your individual needs. If you have a walker or crutches at home that you plan on using, please bring these to the hospital so your therapist can assess them for safety and adjust them to fit you. Advance the walker ahead one step length. Step with the surgical leg even with your walker. Then bring your good leg up even with the surgery leg. Advance the crutches ahead one step length. Step with the surgical leg even with the crutches. Step through with your good leg past the surgery leg. Please bring a comfortable, sturdy shoe for when walking with therapy. Going up and down stairs is always made easier with the assistance of a sturdy, well-secured railing. When possible, it is recommended to have a railing installed prior to surgery. If a railing is not present, your therapist will teach you how to go up and down the stairs with the assistance of crutches. When going upstairs, the saying is, "The good go to heaven." You'll start by placing your good leg up on the step, then bringing up your surgery leg, and then your crutches. Once everything's on the same level, you'll repeat this over again until you reach the top of your stairs. When coming down the stairs, the saying is, "The bad go down." You'll start by taking your crutches and placing them on the step below you, then your surgery leg, followed by your good leg. Once everything comes to the same level, you'll repeat this over again. When going up the curb step, place all four legs of the walker up on the step, then your good leg, and then your surgery leg. When coming down, place all four legs securely down on the ground, step down with your surgery leg, and then your good leg. Finally, we will address exercises. These are an introduction to a few of the exercises that you will be taught by your therapist at the hospital. You may notice there are more exercises for total knee replacement than for total hip replacement. This is because total hip replacement's most important exercise is walking. Ankle pump exercises are performed both by total hip and total knee replacement patients. Gently push down and pull up with the toes. Quad sets are performed both by total hip and total knee replacement patients. They help to strengthen the muscle on top of the leg. Gently tighten the muscle on the top of your thigh, pushing your knee down into the bed, and hold for about 5 seconds. Then relax. Repeat this exercise 10 times. Heel slides are exercises performed by total knee replacement patients. This exercise helps with bending the knee. You start by gently sliding the heel of the surgical leg towards your buttocks until a stretch is felt. Then gently slide the heel back to the starting position. The straight leg raise exercise is performed by knee replacement patients. It helps to strengthen the muscles on the top of the leg, as well as with many activities performed throughout the day. Start by tightening the muscle on top of the leg, then lift the leg 6 inches from the bed, trying to keep your knee straight. Gently lower the leg back to the bed and repeat. The seated knee flexion exercise is performed by knee replacements and helps to increase the knee bending motion. Sit in a chair, keeping your feet flat on the floor, and slide the surgical leg back until a gentle stretch is felt over the knee. You may then slide your knee back to the starting position. Eventually, you'll work up to pulling your knee back and holding it for a gentle 10-second stretch. At that point, you can slide your foot back to the starting position or try to pull your foot back even further. Seated knee extension is performed by total knee replacement patients. It helps to increase knee straightening. Sit in a chair and prop the heel of your surgical leg on a chair or stool of equal height. Keep your knee and toes pointed towards the ceiling. Gently tighten the muscles on the top of your leg or gently press down on your thigh. Hold this for 10 to 15 seconds and relax. It's important to take time each day to lay in bed and rest. Take 2 pillows and lay them under the length of your leg. This will help with swelling. This time you can also place ice on your knee and hip. Leave that on there for 20 minutes at a time. We are confident that with our guidance, you will feel prepared to return home with support from family and friends at the end of your hospital stay. See you soon!
As directed in the video by the physical therapist, they will work with you twice a day. They'll walk with you. They'll do exercises with you. The third time that day, your nursing staff will walk with you, and they'll remind you to do your exercises. It's very important that you practice the exercises that were presented in the video. Therapy after you are discharged really depends on your surgeon and what surgery you've had. For total hips, your physical therapy is mainly just walking, which you can do at home. For total knees, you may go to physical therapy right away. Your surgeon may have you come back to his office and then start you on physical therapy in 2 weeks, or you may do your physical therapy on your own at home. Please ask those questions to your therapist while you're here in the hospital. This is a very busy slide. Mainly what it's telling you is that insurance will pay for a set of crutches or a walker once every 5 years. If you have your own set of crutches, you can bring them into the hospital. If you have your own walker, you can bring it into the hospital. If you don't, physical therapy will work with you and they will get you whichever equipment works best for you at home. It's very important after your total joint replacement for at least 2 years that you take antibiotics for any dental procedure. This will be 4 to 5 pills an hour before the procedure. You want to take this for any dental procedure. Cleanings, fillings, root canals, teeth pulled. Usually your surgeon will order it the first time. After that, your dentist will take over. Please take these antibiotics as long as they are recommended by your surgeon. You cannot drive until you get the okay from your surgeon, and that's usually anywhere from 3 to 6 weeks. You can ride in the car. You will ride in the car to go home. But it's very important to get out and walk about every hour to help with your circulation. I think it's a good idea about every hour while you're awake to do something different. Take a walk, sit in the chair, do your exercises. Please call your surgeon at Des Moines Orthopedic Surgeons at 515-299-6363. You are welcome to call the orthopedic floor at Iowa Lutheran at 515-263-5662 with any questions regarding your surgical leg. Elevated temperature, pain that won't go away, unable to move your leg like you could when you left the hospital. There's pulling apart of your incision. Is there draining from your incision? Any problems with your surgical leg, please call your surgeon. This is the end of our video presentation. There is a book available online for you to use as reference. Please download this book and read through it at least 3 times. This is your total joint education book. Also remember, toes above your nose 4 times a day after surgery when you go home. You will do this anywhere from 2 to 4 weeks. Thank you very much.